think we're live.
Oh, brilliant. Wow.
We'll just give everyone a minute. We just had a technical issue, but hopefully we're up and running now. If anyone can say hello, just to make sure someone's with us. Looks like we've got some people watching. Fabulous, hello and welcome. So we are the Vale Midwives, or some of the Vale Midwives. We'll just go around and introduce ourselves. So my name's Fran. I'm on the Wantage side of the Vale team, and I work here in the Wantage Midwife-led unit.
Hi there, hi, I'm Nicola. I also work here at Wantage and do my clinic at the White Horse Medical Practice in Farringdon.
And I'm Tina, and I'm also a midwife here, and at the moment I'm managing Vale.
So welcome to our session today on our Facebook Live. This is our first attempt at a Facebook Live, so please feel free to ask any questions as we go along, and we'll answer them as we go along. So yeah,
As best
as best
we can.
as we can. And if we don't know, we'll find out the answer and post it later. So we thought we'd do today's session on birth at home. So we've chosen birth at home at the moment to focus on. We've noticed there's been lots of increased interest in birth at home since the coronavirus has hit, and we were just having a discussion before we went live about it'd be interesting to know the statistics for that. But at the moment there's a home birth rate of about 2% before the pandemic that we were aware of. So our aim with the session is to give you some relevant and useful information, and also touch a little bit on the evidence, because there's lots of misconceptions around having babies at home, so we want to cover that for you as well. So I think we're just going to start and talk about what actually having a baby at home means. So it's really a service that we provide. We come to you, so you get a skilled, trained midwife coming to you with all the equipment that we would have at a birth, say at the midwife-led unit, and all the standard equipment we would have even if we were in an obstetric unit. So we do look like we're moving in. We come with lots of bags of kit. So we come to you and we just are there for you to see how the labour progresses, and we're there to sort of monitor and make sure everything is staying on a normal pathway. And then there's always the option to move from home if things veer away from normal. And I think that's what a lot of worries centre around is if things go away from the normal. But the reason we are very pro home birth is women can generally labour quite well at home, because labour is a physiological event. We need to strip birth back to biology and think about what makes women labour well. And generally there's primal safety, so people feeling safe in their own space, and most people feel very comfortable and safe at home. Obviously that's not going to be the case for all women, and we know that birth at home won't be suitable for all women. We are primarily talking today about women having a straightforward and healthy pregnancy, so that is our focus. But having that primal safety, and also privacy as well, and also the freedom of movement. So at home you've got lots of spaces that you can use. You can use the stairs and go up and down the stairs. You can get in a pool if you've got one, or a bath or shower, and you can just be really, really cosy at home. So it's not a be-all and end-all if you decide to start your labour at home. Some people move, and that could be for lots of different reasons, which we'll talk about a little bit later on in the video. But it's kind of a play-it-by-ear option. What we're doing is we're maximising the body's physiology, giving you the optimal setting for a physiological birth, and we're coming to you with all the kit and all the resources that we need. And all midwives, wherever you go, are highly skilled and highly trained in all sorts of scenarios. So we're sort of like the gatekeepers to normal birth, if you like. Anything else you want to add on that?
No, I was just kind of going to just touch on what you just said about moving in. We bring lots and lots of bags with us, but we also, most importantly, bring a fair amount of pain relief with us as well, which most of you might be reassured by. We bring our Entonox cylinders, and we also, you can have pool bursts if you want to have pool bursts, and you can just ask your midwife about hiring a pool and how that's the best way to do. And then you can think about TENS machines, hypnobirthing, and all that, really. And in terms of caring for you during labour, we're just doing exactly the same as anyone in the birth centre or in our delivery suite would be doing. We've been making sure that you and baby are both well, and we've been monitoring you throughout just to make sure that nothing's deviating from normal. And if that was to be the case, we'd be having these discussions with you. And, you know, as Fran said about possibly moving you or transferring you, not only is that if things start to deviate from the norm, that can also be your choice as well if you decide that actually you want further input or you feel more comfortable somewhere else and stronger pain relief.
So, I mean, I think Fran's already mentioned, but all the evidence supports, if you think about an animal, they feel happier in their own environment, in a quiet, dark space, and women will tend to labour better in their own homes, more calmly, usually require less pain relief. And we are guests in your home, but we are also professionals, and would be monitoring you all the time to make sure you were safe. I think that's
I think that's lots of women's fear about home birth is that they won't be safe, but actually, as we've said, we are all very, very highly trained, highly skilled midwives, so that can kind of put you at a bit of ease. And as Tina said, we're visitors into your home really, so as long as we're there to monitor you and baby, in between times we do kind of make ourselves scarce just so you and your partner are there and you've got that optimal oxytocin flowing.
Lots of privacy.
Yeah.
Because women left alone and unobserved generally retreat to a very private space. It's, one midwife I know talks about birth as an elimination, so it's an urge, it's the body's natural urge. You know, you get to a point in your pregnancy where the baby decides, unfortunately, as much as we would like it otherwise, the baby decides that it's kind of time to part ways, and the old word is parturition. So I just saw a question pop up, which just distracted me. So we want to maximise that environment for you and strip everything back to biology so that women can labour, you know, uninhibited and sort of unobserved. So we are there for you, but we're not going to be in your face. We're going to maximise the environment with sort of low-level lighting, which you can set up beforehand, or it can be relatively dark in the birthing environment. But as I said, you know, it seems to be that we've got to this point with birth that we no longer seem to, generally as a whole, I would say, have that much confidence in our bodies as they did even, you know, 50, 60 years ago. Up into the 60s, lots of people still had their babies at home, and then there was this big shift, and lots of people came to the hospital because they reported that having a baby in hospital was safer. But actually, since the Changing Childbirth Report in 1993, it's been made official since then that actually hospital is not the safest place if you're having a straightforward healthy pregnancy. And there's lots of research to support that. Most recently, there was a huge study in 2017 by Hutton et al. And we can link all the research for this at the end if anyone is interested in research like me. So there was a huge study of over 500,000 women which showed that having a baby at home was as safe as being in a midwife-led unit or being in an obstetric unit if you're having a straightforward healthy pregnancy. So as we said, that's what we're focusing on today. If you don't fall into the straightforward healthy pregnancy arena, then please do come talk to your community midwife, and we can, I think Nicola's going to touch on later the sort of parameters of what we're classing straightforward healthy as later as well. But what we want to get across today is that home birth is as safe an option, whether it's your first or second or third baby, it is as safe an option. And I think that's one of the common misconceptions about birth. And lots of people say that they want to go to a hospital just in case. And as we said before, home isn't suitable for everyone because we've got to, again, go back to biology and think about how women labour well. And primal safety is really, really important. And lots of people feel safe at home, but some people do prefer being in a hospital setting. So for those people, their primal safety is actually going to be higher in a hospital setting. So if that's you, then perhaps you would labour better in a hospital setting. So we know it's not for everyone, but we want to sort of open the windows, open the doors to more people to consider having a birth at home, because we absolutely love it. It's women absolutely love it. Again, all the research shows that women's satisfaction with their birth is much higher if they start their labour at home, even if they were to transfer for any reason during the course of the labour.
And we don't really get women, I've never heard a woman saying, well, I wish I hadn't had my baby at home. Have you?
Never.
No. But you know, we understand that some people do feel safer in a hospital. That's fine. But we also want you to know that you have got choices. And wherever you choose, we'll support that.
And lots of people, advantages of having your baby at home is obviously having your partner close. And obviously at the moment, in the current situation, partners are being left out a little bit and not being able to be as involved and having to go home quite quickly following delivery if you're in hospital. So again, that's another advantage of being at home, having a partner around. Obviously, if you've got other children and they're still around or in their bedroom, obviously you need to be prepared for a transfer, just in case, but that's why a lot of people choose as well, because they already have children, they like to leave them without disturbing them too much.
And you'd be surprised, children don't usually wake up
No.
if it's the night. They usually stay asleep, which is a big relief for mothers.
So we've got one question coming from Nikki, which says, "Hi, can you have Neptune at home?"
You absolutely can, yeah. It's one of the drugs that we can bring out to you and give to you. Obviously, if we were concerned that baby was close to being delivered, and we thought the baby was coming quick, we would be assessing you to make sure that wouldn't happen, just because it can make baby a little bit sleepy, and we like babies kicking and screaming when they're born. Obviously, there'll be observations and monitoring that will go with it, but yeah, you can have Neptune at home is the final answer.
Shall we take that opportunity to talk about hiring pools and stuff a little bit?
Yeah.
Yeah, so we can't bring a pool with us. So that is actually, there's companies out there that you can hire pools from or you can buy pools from. We would support you with whatever you choose to do, but we're not allowed to supply them, especially during this difficult time with COVID. So you need to make sure that if you get a pool that you know how to put it up, or your husband knows how to put it up and has filled it up, because there are quite a few times when they haven't practiced and we turn up and the pool's got about 3 inches in and you're ready to push, you know, and they never actually get in the pool. So it's worth having a practice before the actual event.
And the home birth kits come with everything generally, so if you're hiring a kit, it comes with a pump to pump up, so it looks like a giant paddling pool basically, but it comes with a pump to put all the air in the sides of the pool, so it goes up relatively quickly, which is nice, and you don't have to sort of do it by hand, which is even nicer. And they also come with the kits as well to put the water in, so to attach to, say, your kitchen tap and to run it to the pool as well. So it comes with a pipe to fill it. The main thing about hiring birthing pools is making sure that your tap and the connectors fit together, because that's another one I've had a few times. We go out to a home birth and bless them, the tap and the connection don't fit together. There's lots of different tap sizes these days, so making sure that those things work is important. And it also comes with a pump to get rid of the water afterwards as well, so you're not going to be ladling it all out with a bucket or a saucepan.
Yeah, I was going to say, I've seen husbands trying to fill a birthing pool with a saucepan. It does take a long time.
I mean, even this pool in our midwife-led unit, it takes about half an hour to 40 minutes to fill, doesn't it?
Yeah.
So thinking about your heating sort of hot water systems at home as well can make a difference. So if you have an immersion tank, it's probably going to take you a lot longer, because once you've emptied one of those, it's going to take a bit of time to fill up.
And then during labour, obviously it's going to cool down, so we're watching the temperature all the time, because babies have to be born within a range of temperature. They can't be born into too cold or too hot. So we'd be monitoring the pool temperature and getting someone to add hot water at various times to keep the temperature at the right temperature.
One of the other things people worry about is mess as well. So with the pools, they generally come with a tarpaulin to go under the pool to sort of protect the floor. And people worry generally about home birth being messy, per se. I think birth is a lot less messy than people think it's going to be. And I will just say, when ladies' waters break, it isn't quite as dramatic as you would believe if you watch media representations of TV. It's not always a proper gush and everything's flooded, but it can be useful in terms of preparing for a home birth, or just thinking about a covering for the floor if you are having a pool, because getting in and out of the pool, you might obviously have wet feet. And if your waters were to break, as anyone could, whether they're planning to stay at home or not, you might want a cover for the bed or sofa. But we bring with us, as part of our enormous kit, we bring with us lots of super absorbent, we call them Inco sheets, little squares which absorb lots of waters and things as well. So in terms of mess, by the time we leave, everything will be really, really back to normal, apart from if you've hired a pool, because that is the partner's responsibility to sort of package that back to where you got it from. But everything, we'll take all the waste with us. At worst, you might have some washing to do of some towels. So one hot wash or maybe two hot washes, and then normality will be restored again.
Oh, and as far as the water goes, some of you will think, I'm sure some of you will say, oh, I don't like water, it's not for me. But it's something to consider, because I've seen over the years many women get in the pool, say it's not helping, and they get out, and then they say, oh yes, it is helping, and they jump back in. So it's definitely worth considering, because labour's different from any other time, and it is a brilliant way of reducing the discomfort of labour. So it's a consideration, I think.
So we've covered nectar and water, using the pool.
So we were talking spoke earlier about taking the Entonox out with us. So for those of you that are not quite sure, so Entonox, you might have heard of it as gas and air. And that's the one that you breathe in and breathe out again, and lots of women find that really, really useful during labour to help kind of take their mind away from the pain, but also help their breathing. And some people swear by it. Swear that it gives you that drunken feeling that you wouldn't have felt for quite a long time, but without having the hangover.
I did. Did you?
What, have a hangover?
No, like the end like the end tonight.
And then some people hire TENS machines as well, so that's something else that you can look at. So obviously all of these things can be used wherever you go, and I think that's a really important point to make, is that the only thing you can't have at home birth is an epidural. So for ladies that know they want an epidural, then we would be recommending that you head to delivery suite. But lots of women don't know what they want until they go into labour, and there's no pressure either way. Like we said, if you started your labour at home and you decided that an epidural is what you wanted, then we would just move for that reason.
So you could start your labour at home, and at any point, if you chose to go into hospital, we would transfer you in, and we'd go with you as well. And the same with water. You might not want to have your baby in a pool, but you might want to have the labour in the pool, and then you can get out for the birth. So, there's no hard and fast rules. You can change your mind whenever you want.
That brings us nicely probably on to talking about transfers and transfer rates and things, because that's quite often a comment we get. People are worried about moving in labour. Wherever you go to have your baby, if you are at home when labour starts and you go to a birth centre or a hospital, you've already transferred at one point during your labour. So home birth is great in that sense. If you don't transfer, because there's no moving in labour. But if you do transfer, it's no different to going to a birth centre or a hospital, because there is a movement at some point during the labour.
Or we're going to discuss why we might transfer.
So you touched earlier upon during your labour how we'd be monitoring both you and your baby, and if at any point we were concerned that things were starting to deviate from normality, or baby was showing us any signs of not being happy, we would be looking at transferring you. So this would involve calling an ambulance, and then as Tina just said, we would be transferring you up there as well. So the midwife
To the
will be staying
hospital.
with you, absolutely. And then there could be other reasons. Again, the girls have just touched upon, you don't know what you're going to feel like when you go into labour. You know, you might think, oh, I'm not going to use any pain relief, and think, well, actually I really would like that epidural, or you just want to be there for some reason. So that could be another reason we transfer. We listen to you and we follow your lead, basically. If we were concerned, sometimes these little babies practice opening their bowels while you're pregnant with them. And if we notice that their baby had pooed inside you while you were in labour, so the significant meconium, again, we'd be transferring you because baby need to be monitored following delivery.
But that doesn't mean there's necessarily anything wrong at all, because babies can do a poo inside you for lots of different reasons, and it doesn't mean there's anything wrong. But because we can't tell why your baby did the poo, we would prefer you to be in a hospital when you have the baby. But we can't always know that your baby's done a poo, because if your waters go when you're pushing and the baby's born very quickly, then we may not have known before.
And sometimes, you know, as Tina just said, baby will be delivered anyway before you even make it to the hospital. But it's just for those checks that we like to do. Sometimes your waters may go earlier than the contractions start, and if your waters are broken over 18 hours, we like to transfer you because we like to get some antibiotics on board for you to reduce the risk of infection for baby. And yourself. And in terms of baby, like I said, we monitor baby, so if baby was showing any signs of not being quite happy, we'd be transferring you sooner rather than later. If for any reason this baby wasn't in an ideal position for birth, then actually baby was coming bottom first and we hadn't picked that up, again, we would like you in hospital just in case. Sometimes you might have a little bit of bleeding during labour, and you know, if it's with that thick mucousy, spotty show that you sometimes get, that's okay. We don't get overexcited about that. But if it's fresh blood, then we would be wanting to transfer you just to make sure that there was nothing sinister going on. That's it really, isn't it?
And it may be to do with mum, mightn't it? So it could be your blood pressure's higher than we would expect. It might be your temperature's higher than we want it to be.
Sometimes following delivery, you know, most women will bleed a certain amount, but if that blood loss is getting to a point where we're thinking it's a bit more than we really like, we'd like to have you in the hospital setting. And following delivery of the baby, maybe the placenta needs to come away. Sometimes placentas like to hold on, and again, that would be another reason we'd be looking at transferring you. Or if lots of women, I think 75% of women need suturing, particularly following first babies, or midwives are trained to do suturing. But if it was a significant tear, one that was starting to impact on the muscles of the back passage, or ones that were a bit complicated, we'd be wanting to get one of the doctors at the hospital to do that for us.
But the majority we can stitch at home,
Yeah.
and we would give you pain relief for that. So,
I think it's important to draw attention to that. We've talked about when things veer away from normality. So we're there to sort of look after you throughout the labour and pick up when things are veering away from normality. And I think lots of people think that happens all of a sudden, but actually these things generally are slow to build. So we would pick them up well in advance. If there were any concerns about blood pressure, then we would pick it up sooner. Or if we had any concerns about baby's well-being, then we would be recommending moving sooner. I think people think it's always emergencies that people transfer for,
but it's rare.
it's really, really rare to transfer for an actual emergency. Actually, most transfers, from the data that we have, most transfers are because labour's taking a little bit longer than we would like. So just to reassure you, so the main reason is that labour takes a little bit longer, or that baby's pooed in the water's done that meconium. So both of those, we're not in an emergency situation.
Yeah, I just want to reassure you what Fran said, saying, you know, things develop over hours and hours, not minutes. It's usually hours and hours. So we have plenty of warning, and sometimes we transfer when we didn't need to, but we're making sure you're both safe.
And what's fascinating is that even if you start your labour at home and transfer for any reason, you're still more likely to have what we call a spontaneous vaginal birth, and you're still less likely to have interventions or assisted delivery, so like a forceps or a ventouse or an episiotomy, or lose a large amount of blood. All these things are less likely if you start your labour at home. So that's why we're really passionate about talking about birth at home to you today.
Okay, so in your very first booking appointment, one of the questions you'll be asked is where you're planning on having your baby, and obviously the midwife will go through like your options with you. And if you decide to have a home birth, you don't have to decide at that appointment, you can decide later on. But if you have decided that you would like a home birth, us as midwives, we like to do a home birth assessment on you. This isn't always possible to have done at home, particularly at the moment because of COVID, so it might be that we have to do it over the phone. And basically all it involves is kind of just making you aware of all the bags that we bring and how much room we will need. If you are having a pool, where you're going to situate it so we can make sure we get around it, making sure you're easy to find, there's adequate parking. But also touching on, that misconception of how much mess there is as well. We kind of advise lots of shower curtains, maybe just cover your sofas and your carpets, just in those main areas where you're planning on delivering your baby. Other things we like to make sure is we have lots of students working with us, and to make sure that you're happy with students coming to the births as well with us. And in terms that you're aware of all the pain relief and everything that we can provide for you, just really to give you that reassurance. Not sure if there's anything else.
Yeah, so like you said, we come with lots of kit. So we come with 3 bags, 3 big bags, 3 rather large bags.
4, yeah, there's a little suction one as well, just in case. We bring a lot just in
A lot of
case.
kit. So we often, as part of that assessment, as Nicola said, we'll chat with you, and we just make sure there's somewhere that we can put our kit down. And we've talked about safety in terms of you being as safe as, well, you and baby being as safe at home as you would be anywhere else. When we come to your house, we also set up a little area for babies after they're born as well. So that's an area if baby did need any support after they're born. Now that's really, really, really rare across all births in all settings. But we do bring the kit with us should we need it. So we, as I said, we're all highly trained in all sorts of scenarios. So it's often a question I get about baby's well-being.
And I think really importantly as well, just to be aware that, us as midwives, we're very, very open and honest with you. We've touched on anything, kind of deviating, and when we're monitoring, we'll be discussing everything with you during labour and birth, just so you're fully aware of what's going on and kind of what we're thinking in our heads. So,
and everything is your decision, not ours. We want it to be an informed decision, and we want a good relationship with you. And we don't usually have any problems at all, but we just make sure everything is your choice. Nothing's going to be forced on any of you.
And the joys of obviously having a home birth is there is a higher chance of you getting your own community midwife coming to their home birth. It's not always guaranteed because there's a team of us on. Will we plan on meeting the team?
We are going, we're just in the process of setting up meeting. Yeah, shall I bring in the team?
Yeah, sure.
So the whole team aren't here today, but I will introduce you to some of our team. And in the next few weeks, we're going to be divided into sub-teams. So the idea is that you'll have your own little team, and hopefully that you will just see members of your small team in the future. But that is a process that's ongoing.
So hopefully midwives that you will have already met will be the ones that will be coming out to your home birth that you're familiar with.
But I'm going to introduce you to some of the whole of Vale team. I'll just go and see who's available.
So sometimes when we come to the home birth, we also will bring a support worker with us. They're our little angels in disguise who help us out immensely.
We couldn't do our job without them.
Yeah, absolutely couldn't. And in terms of when it came to delivering, we would always call for a second midwife. There's always 2 midwives at your delivery. That's not to mean that you're going to have a house full of people spectating. Generally, when a second midwife comes, a support worker then they go as well. It's just for safety reasons, really, that we have 2 of us there. It would just be the same as if we were at the birthing centre, on delivery suite, anywhere.
It's just because we've only got, you know, 1 set of hands, and then our second midwife can come and write notes and you know, jot the times down that things happen as well. And lots of people worry, I think, about we've talked about Internox and the fact that we bring it with us. If we were running low on that at all, then our amazing MSWs, maternity support workers, could go and fetch some more Internox for us as well. So you're not going to run out.
They too will be your favourite people then.
Yeah. Has anyone got any questions? Anyone that's watching us live got any questions that they wanted to ask as we're here and available
As we're
to chat?
just waiting for some
Can hear them
faces
coming.
to come in. They're coming in.
Who have we got?
Okay, so we've got Sarah.
Hi,
Sarah's just joined our team. She's a midwife, and you may see Sarah during your labour if you deliver a home birth or at the birthing centre.
Yeah, nice to see you all. Sarah's also doing a rotation onto delivery suite as well. So you actually, you know, if you end up on delivery suite, you might see her as well. So a good continuity there and face.
Thank you,
Sarah. Thank you, Sarah. And this is Serena, another midwife for Vale. Serena's worked for Vale for quite a while now. She also works on delivery suite as well.
Nice to meet everyone. Hopefully see you all soon at Lovely Home Birth or here at the unit or on delivery suite. If I'm there.
Thank you.
And this is Anna, support worker, who assists the midwives.
This
Angels
is,
in
this is one of our
disguise.
angels that will bring more Internox if we need it.
Oh, so kind. Yes.
And it's likely you'll meet Anna and the support workers after having your baby as well.
I will. Thank you.
Thank you, Anna.
Is there anyone else?
I think they're with patients, sorry.
Okay. So what else have we got to cover? So we've talked about transferring, we've talked about pain relief options.
So maybe we need to go into a bit more detail about the actual birth. So, you know, you're going to be in labour for so long, and then how you afterwards. Yeah.
Do you want to share?
Okay, so first time mothers tend to have longer labours than second time mothers, or third. First baby's always the longest, usually. So if you weren't sure if you were in labour, you could ring us. Most women tend to labour at night, but some people do deliver in the day. So you would contact your either Wantage Maternity Unit or Wallingford Maternity Unit. Wallingford's got someone on the phone 24 hours a day, and they'll contact a midwife to give you a call. And then the midwife will assess you over the phone. If she thinks you're in established labour or she's not sure, she'll come out to see you. She may bring the equipment with her, or she may ask her second midwife to collect it. And then we'll come to the house, and there's no rush, but we'll be with you for a little while, see what your labour's doing. We might do a vaginal examination, depending how your labour's going and what you would like us to do. We do your observations, make sure everyone's well. And if you were in established labour, which is usually 4 centimetres onwards, but we don't always do a vaginal examination, so we might not know your 4 centimetres, but we know by looking at you that you are in established labour. Then you are not going to be left. You'll be with a midwife until you've had that baby. So this could take a lot of hours. First time mums can take a long time to have a baby. So it would be normal. We wouldn't worry if it took you 12 hours to get from 4 centimetres to the pushing stage with your first baby. We would consider that very normal. Hopefully it will be quicker, but if it may not be. And then we'd let you push for about 2 hours, would you say, depending on if everything's okay?
Yeah,
It depends, everyone's different really. But we just make sure everything's normal. Second time, third time mums tend to be a lot quicker. And sometimes we arrive and you might say, I want to push. We don't have time to do anything, we just deliver your baby. So when you have your baby, when you get to the pushing stage, you get this, it's a bit like you get an urge to do a massive poo, I'm afraid.
yeah.
And some women get the overwhelming urge to push, and some women don't. And sometimes a midwife would need to encourage you to push, and sometimes you don't need to say anything. You just do it all on your own. Everyone is different. And then usually we just deliver your baby onto your chest or your tummy. And we wrap the baby in a towel. We just leave your baby there, and we just let the cord just slowly stop pulsating, because it's usually good for a baby to get that extra oxygen with the cord while the cord's still pulsating. George,
So and then once the baby's delivered, we've got to deliver the placenta or birth the placenta, and lots of women choose either between waiting for that to happen naturally, physiological third stage, and some women choose to have an injection to help deliver the placenta, both of which we can do at home. But this birth of the placenta time, when it's broken down into stages, is referred to as the third stage. To birth a placenta, you need the same sort of environment you do ideally to birth a baby. So if we're going down the physiology route, we still need to keep that lovely oxytocin-filled room and space, nice lots of dark privacy type arena. And that will be a really special time when your baby is on your chest and skin to skin with you, for you to get to know baby. When it comes to the placenta, lots of people worry about timings, etc. But when you've got your baby in your arms, I don't think people are as worried about how long it takes to birth a placenta. And a placenta is soft and squishy, hasn't got a nice firm bony head like baby, obviously. So it's much different to birth a placenta than it is to a baby. And I always find when we come to the birth of the placenta that the toilet is generally a good place to go and birth the placenta. Again, you've got privacy, you know, that's where you would go to open your bowels. You wouldn't do that in front of people under bright lights. But also you have gravity on your side and your legs are open, so it gives a bit of space for the placenta to come. But if you did want the injection to help deliver the placenta, then we bring that with us, so we would be able to do that for you. And if we've talked about the realms of normality, and we'll be observing that all the time, but if we were worried about bleeding, then we might be offering you an injection as well, just to help sort of slow the bleeding, stop the bleeding, to keep it, to keep everything within normal.
Yeah.
And then the great thing about being at home is, once the placenta's out, we can start thinking about tea and toast, can't we? So partner's job changes a little bit after you've had lots of time to get to know baby, and it moves on to getting refreshments and things. And we would offer to check to see if you needed any stitches. So we can do that at home. And as Nicola said earlier, if the tear was complex or deep, then we might recommend moving for that reason. But otherwise, we bring all the stuff so that we can do the needlework at home. And then once that's done, most people get comfortable and cosy. You might go for a shower if you feel up for it. Obviously, this is your home in your territory, so whenever you're ready, and then enjoy a lovely cup of tea and a slice of toast if that's what you like.
And lots of things to do with your baby.
Yeah.
Yeah. We also bring scales to a house so we can make sure that we weigh baby and do that initial weight on baby, and also we bring the vitamin K, and you have the option whether you want the baby to have that. as a little injection on top of their thigh, or whether you want them to have it orally. The injections are one-off, and orally would be done at birth, day 5, when you have day 5, wait and heel prick if you're happy to have that done, and again at day 28 if you're exclusively breastfeeding. The midwives will also help you with that first feed if you're planning on breastfeeding, or otherwise you have your formula ready at hand. Make sure everything's ready, and then like the joys of being at home is the midwife will just pop her around, clean all her mess up, and after a couple of hours, if you're happy, then we just go home.
Yeah, we leave you to it and you don't have to
Leave you to
move.
go with your baby as a family.
But we can be there, as Nicola said, we can support with feeding, you know, whether it's breast or bottle, we can give help and advice with the first feed and make sure that you're confident, and we'll give you all the contact numbers of who you can contact over the course of the night before we come back the next day or the afternoon, depending on what time of day. Just assumed that it would be night. We can give you all the contact numbers if you run into any difficulties with feeding. As we mentioned earlier, Wallingford are available 24/7, so they have a maternity support worker that can answer any feeding queries or support you over the course of the night when we're not in the unit per se. But we are here in the Wantage Maternity Unit 7 days a week. So yeah, and we're always more than happy to help with any queries, and that's whether you have baby at home or anywhere else.
Yeah. Does anybody have any questions at all for us? Nothing coming in at the moment.
Nothing coming in, they're so quiet.
I'm not sure I think we're covered.
So
Unless you are, right.
Tina was just talking about sort of, you know, generally what to expect in terms of labour. It is very difficult to have that conversation because everyone is a little bit different. But when we go back to biology and what women need to give birth, really they need to switch off the thinking part of their brain. And this is why we're very pro home birth, if you like, because often women can do that quite well at home. And if women move in labour, then
Excuse me, I've got to take Nicola out for something.
Okay.
Sorry guys.
So if women move or transfer in labour, whether that was a planned transfer, you know, if you started your labour at home and then you were planning on going to, I don't know, the Spires, for example, anyway, what often happens is the journey in the car can sort of kickstart your adrenaline, which is the hormone that we don't necessarily want awake during labour. We kind of want people to be not stressed, not adrenaline fueled, because what happens with adrenaline is adrenaline sends all your oxygenated blood to your arms and to your legs. So it's your fight and flight hormone, and we really want to avoid that in labour, because when your uterus is contracting, we want all the oxygenated blood to go to your uterus. That's where it's going to be most efficient, and that's how we're going to get to see baby. And the reason we talk about home birth being the optimal setting for a straightforward, healthy pregnancy is because it enables women to hopefully relax, feel safe, feel calm and confident, and therefore they generally have more oxytocin flowing, and it's oxytocin that's going to give your uterus contractions. But oxytocin is a shy hormone, so you don't tend to have lots of oxytocin and adrenaline at the same time. If your adrenaline goes up, your oxytocin goes down. So we really want it the other way around. And when people transfer, or if you meet new people in the course of your labour, what can happen is the adrenaline can slightly rise a little bit, and that can be sometimes when labour slows a little bit. So if you're staying at home and if you haven't met the midwife that's coming to see you, if you open your eyes and see a new face, then you're going to want to retreat back into that privacy. But if you're going into hospital or into a birth centre, likely there'll be a spike, a peak in adrenaline briefly, whilst you adjust to...
I've just been called to a home birth, so I'm sorry, I'm going to have to leave you all.
This is great. So whilst you adjust to a new environment, so that's why, as Tina said, generally when you are met by a midwife, wherever you go, or if you stay at home, we take time to sort of, you know, make sure that you're relaxed and we're not intervening or interfering with the setting that you've created, or keeping it at the same pace. It's very, very distracting, but it's great news that we've got another home birth going on. Just goes to show, as we said, we've had lots more home births lately, and they are wonderful. I wonder whether anyone was watching this and they went into labour. Has anyone got any more questions? So going back to physiology, as I said, we want to avoid adrenaline. So your adrenaline is going to make your oxygenated blood go to your arms and your legs ready to run away. And if we can keep your oxygenated blood going to your uterus, then your uterus can work more effectively. It's very basic physiology. That's going to make your labour more efficient. If we can keep the oxytocin going, then your contractions are going to keep coming and also work more effectively. And the contractions are going to push your baby's head down onto the cervix. And that pressure on the cervix is like a feedback loop. It's going to send more oxytocin, and ultimately your baby's going to slowly be pushed from the top of your uterus down through your cervix, which is going to help it open and dilate, and that's how we're going to see your baby. So if we can maximise that environment wherever you go, that's what we're looking for. If anyone is interested in home birth, then we would recommend that you have a chat with your community midwife. And if anyone has any questions about whether they think a home birth is for them, or whether they meet the criteria of sort of a healthy, straightforward pregnancy, then come and have a chat with us. We're more than happy to chat with you. Some people decide to have a conversation with one of our consultant midwives in the trust as well. So they're fabulous. They can give you lots of evidence-based information.
Sorry about that.
It's okay. Couldn't be more perfect. Okay. So the consultant midwives will give you lots of evidence-based information. So if someone was outside of sort of that straightforward, healthy pathway, then they could give you a bit more guidance on that as well. I love my research side and statistics and things, so as I said, we can post a link to the latest evidence base behind having babies at home, and if anyone is worried about safety aspects, etc. If you like a nice little read, there's a very good book that I've got here, which is called Why Home Birth Matters. If you like your light reading, it's a very small book, so but it's got lots of information in it. Lots of the stuff that we've covered today is in there as well. Is there anything you think we haven't covered?
I think you covered a lot of things. I was out when you finished, but is there any questions anyone would like to ask us that we haven't talked about?
No. I think we're coming towards the end of the session anyway.
So that's just an option for those of you who have already considered it, or those of you who haven't considered a home birth. But you've also got your birthing centres, you've got the main delivery suites, you've also got places outside Oxfordshire you could deliver as well for some of you.
So I think we're sort of, to end it off, just to recap, what we're saying and what is research based is that if you're having a straightforward healthy pregnancy, having your baby at home is as safe as having your baby anywhere else. We're very, very fortunate in the UK. We have a very good maternity service, and we have access to support services like ambulances, etc. if we needed them. A lot of misconceptions about home birth are that there's more problems that arise at home, but that's not the case at all. In terms of transfer rates, you're less likely to transfer from a home birth. It's about 21%, and that doesn't mean that that's because anything was wrong. It could be that a woman wanted an epidural, etc. Although statistically that's less likely as well. But it could be that her blood pressure went up, for example. And it's very, very rare to transfer for emergency scenarios as well. So we just want to give you some food for thought today, and come and have a little chat with the community midwife if you want any more information. And we've got a home birth going on.
Thank you. Thanks very much.
Take care, bye.